Hey everyone, this is Arjun Vijay from AlphaStreet, and I have with me today co-founder and chief operating officer of Predictmedix, Rahul Kushwah. Hey Rahul, thank you so much for speaking with us. It's good to have you here.
Well, you know what? It's great connecting with you. Before our call, I guess I found you on LinkedIn.
Definitely, definitely. So, anyways, Rahul, thank you so much for speaking with us. Deeply appreciate it. So, Rahul, let's just start with your most interesting product, the Safe Entry Station. What's so special about this solution, and what's the market potential?
At Predictmedix, I mean, our focus is all about commercializing AI-based solutions that have a huge impact, especially on the workplace health and safety. Now, talking about safe entry stations, as the name suggests, it's about bringing safety into workplaces. So just how when you look at office buildings, airports, there are metal detectors to screen for ammunition or metals overall. With Safe Entry Station, the premise is to roll out these non-invasive technologies in these walkways that can screen for symptoms of infectious disease like COVID-19 and also screen for signs of impairment.
And how accurate would you say these stations are, and what's the accuracy standards in the industry?
So again, I mean, if you look at the industry overall, ever since COVID started, you have sort of these temperature scanners which are available all over the place. But the biggest problem with these temperature scanners is that they're looking at your surface skin temperature, and so the negative predictive value is somewhere between 50 to 60%, basically meaning that they're off most of the time. When it comes to our safe entry stations, these are looking at multiple symptoms that associate with infectious disease. We have collected and are actively collecting data from clinical facilities all over the world to train the AI algorithms. So in terms of going down into symptoms, we are sitting at around 95%. And that's where we have had some very successful deployment at tier one events and with tier one customers as well.
Understood. And do you think COVID has actually driven an interest for these kind of solutions?
Oh, for sure. So before COVID, we were actually working on adding AI functionality to safe entry stations, particularly for the flu pandemic. Because from a workplace health and safety standpoint, I mean, every season in North America, Europe, basically all over the world, workplaces are hit, and it does cost billions of dollars in lost productivity. And next thing you know, we were in the midst of a COVID-19 pandemic, and that's where we were able to pivot our technology, particularly because of the clinical associations we have, because for AI, you need that data. And we were able to come out a product which is very timely for COVID-19. And now what we are realizing is that after the rounds of vaccinations, everyone sort of is coming to the consensus that COVID is actually, to a large extent, here to stay. So it's about, we cannot just shut down economies forever. We have to live, we have to play, we have to basically be in this environment, and we have to learn how to adapt to this environment. And that is precisely where the safe entry stations come in. It's about, yes, workplaces can function how they used to before, but now let's bring in the technologies that basically make sure that everyone who's coming in is clean of infectious disease or not showing signs of impairment, so you can minimize the spread of infection in a workplace setting or even at a large event.
Makes a lot of sense. And what can you tell us about the revenues that you're generating from this? And also, it would be great if you can touch upon the margins as well.
So the model that we have at safe entry stations, I mean, there is the upfront hardware side to it. We're actually, for us, for Predictmedix, we actually make somewhere between $3,500 to $12,000, depending on which partner we are going through, which part of the world the unit is being sold in. And then there is the monthly SaaS model, which is basically dependent on the number of scans. Let's say a client is agreeing to, but typically our contracts are 12 to 24 months. And the monthly SaaS number can be anywhere between $1,500 to $3,000 a month. We have executed multiple, well, I can call them multi-year contracts. For instance, with Flowwater, for all their North American operations, the units have been deployed, and that's essentially a 2-year contract. Similarly, with one of the largest property managers in Alberta, Canada, We have deployed it across a bunch of their office buildings, even the Calgary Tower, and that again is a 2-year contract. And at the same time, I mean, we have been doing in the live event space. I mean, just today, for instance, we announced a revenue generating placement in the Hamptons at the Palm Tree Music Festival, where the key for us is not just to have our technology to create that into a safe environment, but also about showcasing our technology to the attendees and some other key parties that are going to be there at the festival. But just looking at our business model, I mean, for us to achieve multi-million-dollar revenue, quite frankly, we do not need tons and tons of deployment. And at the same time, because it's SaaS based, you actually do have that recurring revenue there. And I mean, it's basically a software at the end of the day, which is doing that scanning month to month. So we have pretty high margins there as well.
All right, cool. And I understand you have a couple of other solutions as well. What's the update there, and have they started generating revenues?
So when it comes to the impairment solution, no, it's not generating revenue yet. We have and are initiating some more pilots in Asia and also here in North America. So the technology is on the verge of being commercialized, but the way to look at it is as when you get a safe entry station in a workplace. So now let's say right now it's screening for signs of infectious disease. It's the same safe entry station that can run the impairment solution as well. So it's about positioning safe entry station as this gateway unit in a workplace where this is going to solve basically the largest problems that are encountered in a workplace setting from a health and wellness perspective. And along with that, we also have a remote patient monitoring platform. So right now, as we speak, we are adding some more AI-related functionality to it, where as patients are using the remote patient monitoring platform, if there are certain changes in trends which are observed, the platform can send out alerts, and it can also help physicians in terms of their decision making. And we do anticipate that to be rolled out sometime in the second half of this year.
Terrific. And Rahul, what's going to be the management's focus over the next couple of years?
So again, the biggest focus for us is about workplace health and safety, because quite frankly, before COVID struck, everyone used to talk about it, but realistically, there wasn't much that was being done about it. I mean, if you were to attend a workplace health and safety conference, you would essentially see a lot of paperwork. That's it. But now with COVID-19, there has been this dramatic change where workplace health and safety has come to the forefront. And we want to be really, I mean, the biggest force in this setting where we are the ones that are deploying these safe entry stations, and we are actually commercializing and launching and successfully deploying these AI-based solutions, which can really make a difference from workplace health and safety perspective. And at the end of the day, can lead to perhaps billions of dollars in cost savings on a global scale.
That sounds very promising, Rahul. And just I think another aspect of the company that I think viewers would be interested is your cash balance. How do you see your cash balance, and should we expect any fundraising activities in the upcoming months?
So again, you know what, just looking at the last financials we filed, I mean, we do have a relatively low burn rate. It's around $100,000 a month. And based on our last financials, we were sitting at around 1.7 million. And considering that we are executing these multi-year contracts, and there is definitely a lot more in the pipeline, I personally, and especially from the management perspective, we do not envision a fundraising in the near short term.
Is uplisting to a major exchange on the cards at this moment?
Yes, 100%. And that's where we have partnered with Kingswood. Well, now they're called EF Hutton, based out of New York City. And that's the plan that we are working on with them. And of course, at the same time, we have filed with the SEC to become a fully reporting US issuer. And that should be coming to fruition within the next few weeks.
All right, terrific. Lastly, just one more question, Rahul. I think people would be interested to know a little bit about your background.
Yeah, I mean, absolutely. That's a question I get all the time, because I actually come from the academic world. So before I became an entrepreneur, I was a scientist with the federal government of Canada, and I was also a professor at the University of Ottawa Medical School. And I guess one of the things that I did realize in the academic world, I mean, as much I was focusing on immunology research and genetics research and stem cell research, that there have been all these breakthrough developments in non-core medicine fields. So how about we try to merge them together? I mean, I think one of the areas that's really missing when you talk about healthcare research is about different sort of different fields coming together, because that's how you come up with the coherent solution, and that's how Predictmedix was born. So it was more about taking the expertise that I had in the healthcare setting and combining it with the latest developments that were going on in the field of AI and machine learning. And it's about how do we bring it together, not for an academic pursuit, but actually to solve real world problems. And that's what we are doing at Predictmedix, whether it comes to a cannabis and alcohol impairment, infectious disease, or any problem that plagues workplace health and safety.
Wonderful. So I'll just wrap up with that. Thanks for those really great responses, Rahul, and appreciate your time once again.
Absolute pleasure.
Thank you so much.